Welcome to Snackable Health with Gibson and Kohli, and we're talking about the new vitamin recommendations. Big week this week. Talk to us a little bit about what they said, Payal.
Mike, we've been asking ourselves as physicians and healthcare providers if vitamins really do any benefit. Taking dietary supplements, which we know up to 50% of people have said they take, dietary supplements. Up to 30% of people have said that they take a multivitamin, but are they doing any good? So the U.S. Preventive Services Task Force, really mandated this commissioned review of all the literature out there, look at all the studies done to date so that we can get some definitive answers about whether vitamins are beneficial or not. And I was really surprised to see the findings.
A lot of family members call me about this. This is a big issue. What did they say?
Well, so they had a few different findings. So first of all, they found that a multivitamin, which I know many of us take for just good health or what have you, there was insufficient data to suggest that it benefited or that it harmed. But if you kind of parse it out a little bit more, it showed that no effect on cardiovascular disease risk, maybe a little beneficial effect on cancer, but the effect size was pretty small. But it could have some harm, potentially a small increased signal for something like cataracts. So in totality, they sort of shrugged their shoulders and they said, there's not really evidence to tell us that it's benefiting or harming. So we don't really think you should take it. And that's what I'm telling my patients moving forward, is that unless we know that something is helping you, I don't think there's a compelling reason to take a vitamin just for good measure. But I'm curious, do you take a multivitamin?
I don't. I had for a while the Centrum Silver, but back long ago in the 90s, there's this idea that beta carotene could be helpful. Vitamin E could be helpful because of the antioxidation properties. But in randomized trials, that wasn't borne out. In fact, things went a little bit the wrong way with a little higher risk of things like lung cancer. So any specifics about beta carotene or vitamin E?
In fact, that's exactly what they said. They said there was a signal for harm with beta carotene, which I used to take in the 90s as well, because my parents told me it was good for my eyes to take that. It was a vitamin A beta carotene combination pill that I would take. And what they found is that beta carotene supplementation, especially in those people who may have had smoking or tobacco exposure or asbestos exposure, increases their risk for lung cancer, and there's actually a signal for harm. So certainly they advised against beta carotene, specifically in that population, but in general as well. With respect to the other vitamins, though, Mike, it's interesting because there was some mixed data for those as well. So vitamin E, there was a couple of small studies that they found that suggested may increase risk for hemorrhagic stroke, which is a type of stroke where you can bleed into your brain. There was an increased risk for kidney stones occurring from vitamin D and from calcium. And vitamin D is, obviously something that I take. But I want to be clear that the U.S. Preventive Services Task Force just looked at two things: cancer and heart disease. So if you need vitamin D or calcium or something else for your bone health, you still need to obviously have that conversation with your doctor.
Good point. And pregnant women, we're not talking about folate in pregnant women here either, right?
No, we're not. And they didn't actually comment on that particular thing. But of course, pregnant women definitely need folate. As we get older, we can also get malabsorption of certain vitamins, such as vitamin B12. If we're vegans, for example, we don't have a lot of animal products in our diet. We can also get deficiencies of vitamin B12. So, Mike, my take-home message from this and what I'm telling my patients is that don't just take a multivitamin or take a fish oil or anything else just for good health, but really tailor your vitamin regimen according to what your conditions are in consultation with your doctor. And if you are repleting something like vitamin D or whatever, make sure that you're checking levels to make sure you're not getting really high or supra-therapeutic doses of that vitamin or nutrient.
Well, make sure it's doing something good for you rather than just giving you really expensive urine, right?
That's exactly right. And it's expensive urine, and it can interfere with your other medications. And it's something that we think we're doing for our health, which is obviously, I commend the people who are doing that self-care and taking the vitamins as a way of self-care. So the self-care piece of it is really important, but not necessarily through those vitamins.
Good point. Well said. Thanks, Payal, and thanks to all of you for joining us here for this episode of Snackable Health.